Well, what are some other vaccines? How about liver disease? Are there vaccines to prevent that?
Sure. There are a couple of vaccines to prevent hepatitis, inflammation of your liver. One's Hepatitis A vaccine, very effective vaccine. It's a 2-dose series. And anybody who travels and eats food should get the Hepatitis A vaccine. And sometimes I say anybody who eats out period needs to get the Hepatitis A vaccine, because you can get it, if people might remember that we had a Hepatitis A outbreak here in Knox County before my time at the health department related to some green onions. So you can get it eating domestically, not just overseas. So it's a really safe and effective vaccine. So anybody who wants it should get it. There are some other risk groups that people might want to talk to their doctor about. And then there's Hepatitis B vaccine. And you and I both know medical care workers or healthcare workers have to get that as part of their routine. And anybody who's exposed to blood and body fluids of patients or somebody who has hepatitis B needs to get it. It's a three-shot series. Again, a very effective vaccine. Some folks have trouble responding to it. They're called non-responders. We're not sure if they don't have protection or if they just don't produce the antibodies. If they were to get sick with hepatitis B, we're not sure if it would work or not, to be honest. It's kind of one of those unknowns. Again, anybody who's worried about getting hepatitis B should go ahead and get vaccinated. Again, it's a safe vaccine. We're now vaccinating children, so most children have been vaccinated against hepatitis B, so we won't be seeing adults needing that for long.
How dangerous is hepatitis, and what is hepatitis?
Sure. Hepatitis is a virus that attacks your liver and it causes inflammation. And your liver is kind of it's the cleaner, kind of keeps your blood system clean and keeps you healthy. And so when it gets inflamed, it doesn't work very well. So those toxins that it's trying to get out of your body that you don't need don't get cleared out of your body, so they build up. And you've heard people talk about yellow jaundice. That's where people's skin and even their eyeballs can get yellow because those toxins come out in their skin and you can see them. And hepatitis B can become chronic, and so you are at increased risk for chronic liver problems with that, even liver cancer with that. So it is really something important to prevent. Hepatitis A doesn't become chronic. It's usually just one time, you get over it. But the one we don't have a vaccine for is Hep C, and that's another one like Hep B. It can become chronic.
I hope that we'll get one for Hep C, because that can be a biggie. I'm getting more and more excited about what we can do with flu shots, with pneumonia shots, with shingles shots, with hepatitis shots.